Jerusalem, the number of Palestinians injured was 4,739.
So thank you very, very much to all our speakers for this extensive briefing. I think we have had a lot of information. And again, as requested by the journalists, please send your notes either directly or through UNICEF, so that the numbers that have been mentioned are available for everyone. Thank you so much. Thank you, Fabrizio. Thank you, Lucia. Thank you, Matthias. I know you had to change one of your appointments to be with us this morning. It's really much appreciated that you were here to brief the Geneva Press Corps. And good luck with your work in the next days. It's going to be very, very important and sometimes difficult. So thank you very, very much. I turn now to Claire for WMO. Claire, you have 3 points indeed this morning. Go ahead.
Yes, good morning. Good morning, everybody. Another above normal hurricane season is expected this year, and this comes even as many communities in the Caribbean, Central America, and parts of the United States are still recovering from the record-breaking 2020 season. And obviously, for the second straight year, disaster management, emergency management and response is compounded by the challenges of the COVID-19 pandemic. The US National Oceanic and Atmospheric Administration's Climate Prediction Center last night issued a press release and a new forecast, forecasting a 60% chance of an above normal season and a 30% chance of a near normal season. So what we're looking at in practical terms is a likely range of 13 to 20 named storms, of which 6 to 10 could become hurricanes. That's winds of 119 kilometers and above, including 3 to 5 major hurricanes. So that's category 3, 4, and 5. The Atlantic hurricane season officially begins on the 1st of June, although having said that, the National Hurricane Center is currently monitoring an area just east of Bermuda for development into a tropical cyclone. The past 6 seasons have all seen above average activity. We've unfortunately seen hundreds of casualties, billions of dollars of damage. And just to refresh your memory, last year we saw a record-breaking 30 named tropical storms, including 13 hurricanes and 6 major hurricanes. Why are we expecting above average season? Lots of different factors, one of them being that the El Nino Southern Oscillation is currently neutral. When we have an El Nino event, it tends to suppress hurricane activity, and at the moment we don't. Just to refresh your memory about the names, which is the thing that seems to interest most journalists, we do have rotating lists of names. So the first name on the list this year will be Anna, followed by Bill, Claudette, etc., and so it goes on. Last year we exhausted the list of regular names and used the Greek alphabet. If, and it's unlikely, but if we do exhaust the list of names this year, we will not be using the Greek alphabet. The WMO Hurricane Committee decided it was too confusing. And so what they did instead is to agree a new supplemental list of names, which will be used in the unlikely event that the regular names are exhausted. Moving on, I know sort of looking out of the window doesn't bring to mind heat waves, warmth, anything like that. Just because it's cool in Geneva and in fact in many parts of Europe doesn't mean that it's cool everywhere in the world. If you look at the map, you'll see this deep red over quite a large part of the northwestern Russian Federation. We're seeing record temperatures In many places over 30 degrees. Moscow has seen, sort of several days over 30 degrees Celsius. And the Arctic, we're also seeing very warm temperatures at the moment in the Arctic. Yesterday, there was the Ministerial of the Arctic Council, which is, a group of nations which gets together. They've all got, common Arctic interests. And for that event, a new scientific report was published by the Arctic Monitoring and Assessment Program. This is the official scientific body which reports to the Arctic Council. And it had some quite disturbing findings. It said that new observations show that the increase in Arctic average surface temperature between 1979 and 2019 was 3 times higher than the global average. Until now, we've been saying that the Arctic is heating more than twice as fast as the rest of the globe. This new paper says it's in fact 3 times as fast. And to quote the report, climate change impacts on Arctic communities, ecosystems and species, especially when associated with extreme events, are considerable and accelerating. Sea ice loss, glacier retreat and reduced snow cover remobilizes previously deposited contaminants, according to the report. Another headline statement says that climate change, as I've just said, is a here and now problem in the Arctic. Why does it matter to us? It matters a lot. The report stresses, as we've been stressing for many, many months, no one on Earth is immune to Arctic warming. The effects of Arctic change are felt far beyond the Arctic, including the impacts of global sea level rise, the opportunities and risks associated with the opening of new shipping routes and improved access to fossil fuel reserves, and the potential for feedbacks, so it's the loop effect, that affect greenhouse gas concentrations. And here, obviously, we're thinking of permafrost. Once we see permafrost starting to thaw, that has big potential to release methane. Reduced Arctic sea ice means a greater dark ocean surface. Dark surfaces absorb heat, whereas ice reflects heat. So there are a lot of actual and potential feedbacks. And thirdly, just a quick announcement. On Thursday, we will be releasing press release on new temperature predictions for the coming 5 years. This is based on a decadal update from the UK's Met Office, which is our lead centre for this. So we'll be issuing a press release in all official languages, and we'll send it out under embargo. Thank you.
Thank you very much, Claire, for all this information. Any question to Claire? I don't see any. Wait a second. No, I don't see any question on the platform for you. So thank you very much, Claire.
Okay. Have a nice, cool weekend.
Yeah, hopefully
long weekend.
Bring us
No, it's not.
information about a little bit warmer or temperature in the future. Thank you. And now I'm left to give the floor to Jens for an announcement. Jens.
Thank you, Alessandra, and good morning, everyone. Nepal is at the moment in the middle of its worst COVID-19 outbreak and facing breaking points. In fact, the country is experiencing roughly the same number of daily cases per capita as India, but with a health system with much less capacity. The UN and our partners are therefore today launching a COVID-19 response plan for Nepal, calling for nearly $84 million to assist 750,000 of the most vulnerable people affected by the pandemic over the next 3 months. Millions of people are struggling with the direct health impact of the pandemic, but also hunger, malnutrition, devastating economic losses, and other health needs that are being overlooked. The current outbreak is hitting the poorest and most marginalized people in Nepal the hardest. Our plan calls for swift action and international solidarity that is desperately needed to save lives and prevent unnecessary suffering today and in difficult weeks to come. We have no time to lose. I have sent you the press release that goes along with this announcement. Thank you.
Thank you very much. And if there are requests for interviews, I guess you can help out with this. Any question for Jens? I don't see any. So thank you very much, Jens, and also thanks for the press release. I have a few announcements for you. First of all, oh, sorry, no, the hands are coming up. I don't know for whom, but I'll start with Tamara.
Yes, thank you, Alessandra. It is for IOM to follow up the situation in Morocco and the Spanish-Morocco borders, if there is an update on the situation there. And the second question to the WHO, if they would like to share with us the statement of Dr. Tedros before delivery and under embargo, it will be great for Monday. Thank you very much.
Thank you very much. I see that we have IOM on the line. Safa, you are connected, right? I could see you, and now I can't see you anymore.
Yes.
So, yes, here you are. So maybe you want to say something about the question of Tamer, and then Margaret, if you could just confirm about the distribution of the speech.
Yes, thanks, Tamer, for the question. We are following with great concern the situation in Ceuta in Spain. We have noticed the increase in overall arrivals in the European Union via sea routes. However, IOM's position is that arrivals in Europe are still manageable through a better migration governance and through a better show of solidarity. Our teams are following up on the situation, and if we have any further updates, we'll make sure to share them with you.
Thank you very much. I think Margaret is connected. Margaret, you want to say something about the issue of the speech, or?
Yeah, I would just to say that, as normally when we do the World Health Assembly in person, you get it the minute the speech starts. I know it's different because we're doing it via Zoom. I'll pass that on. I think at the moment you will probably get it when the speech starts, but I'll pass your request on because it does make sense. As long as you understand, you must check it against delivery.
Thank you. And Jamil, for whom is your question?
Hi, Alessandra. Hi, Margaret, again. Sorry for that. My question is about the identification in Brazil of cases of the variant that was first identified in India. My question to you, how worrying is it when a country that is already on its knees because of a situation finds itself with a new variant? And what are your suggestions to Brazil with this new identification? Thank you.
Thanks, Jamil, and good question as always. The variant that was first, you're talking about the variant 1617 that was first identified in India in October last year and was recently upgraded a variant of concern. I think that's the one you're referring to. So the B1617, it's got 3 actual lineages, and there is a concern that it does have increased transmissibility. So because it's got an increased ability to transmit itself, the advice to Brazil and any country is to really strengthen those public health social measures so you make sure you're not giving that virus a chance to spread itself, that you're really not making sure that you don't have social mixing so people who may have it can't give it to somebody else. You really pay attention to the distancing, you pay attention to avoiding the crowding in closed settings, you improved your ventilation, and you increase your testing, and you increase your genetic sequencing. And I know Brazil is doing a lot of work on genetic sequencing because this is critical not just for Brazil, but for every country, that we really increase our capacity to do the genetic sequencing so we can get ahead of these variants, track them, and stop them.
Thank you very much. Lisa, is this also for Margaret?
Yes, it is. Morning, Margaret. About the WHA next week, a few specific details, please. We will, I assume, be informed as to who the dignitaries are that will be speaking on Monday morning. And do you have a time for Dr. Tedros' speech on Monday? And then more specifically, I'd like to know whether the daily agenda that comes out, will they, I hope, be more specific in terms of the times of important events as they occur, because everything right now is a little bit abstract, but maybe that's because it's still early days. So that's essentially it. Thank you.
Thanks, Lisa. I don't have a specific time, but I would expect early afternoon for the Director General's speech. We do have, we were seeking a timetable document for that very reason, to give you much greater clarity on what's going on every day. As soon as we have that, we'll alert you to ensure that you've got that information. I think Fidela was going to join me today, but she doesn't seem to be.
Actually, it's not Fadela, it's Christian. He is on the line, and in fact, he has raised his hand, okay. Margaret. If you wish, I can give him the floor.
Because that's great. I'll let Christian take over on this, because he's got more up-to-date information.
Christian.
Thank you very much, and good morning, all. Yeah, as Margaret was joining the press conference, I got an update, so she couldn't see this. The DG will give his main report at around 11:30 and in the afternoon, he will make very brief other remarks to open the general debate, and will then refer member states to its earlier speech. So what you're looking for is the main report at around 11:30. Over.
And before it comes from the journalist, Christian, if there's anything you can circulate in writing with the timing, it would be useful.
Thank you, but that's what Margaret said already. We're trying each year to have the speech way ahead of time, but it's always the same. We're lucky.
Yeah.
If we
no, I was speaking about the agenda more than the speech.
That will be shared. That will be shared later today. I believe, and Fadela is in charge of that exactly.
Great, thank you, Jamie.
Hi, thank you, Alessandra. And forgive me for being nitpicky, but Margaret, if you could possibly lower your camera slightly so we can get your head more in the center of the. There you go, perfect. Thank you. I just wanted to ask you. We received just shortly before the briefing this morning a note from WHO about the World Health Statistics report, in particular excess deaths in connection with COVID-19. Could you just give us a few snippets of that and just summarize a little bit about what some of the findings were, if you have them handy?
Margaret, I think you had a briefing, right, on that this morning?
That's right. And I actually don't have the snippets in front of me, Jamie, because we had a briefing this morning. But essentially, if you're interested in the mortality, there was an assessment of the expected mortality last year, based on the historical record and the actual mortality, and it was found that indeed there was a much greater number of excess deaths, and leading to that, the assumption is that the number of deaths caused by COVID and indirectly by COVID, so that is people who couldn't get to hospital for other things, people who had suffered for other reasons, for deprivation because services were not available during COVID. The assumption is that it is likely that the true impact in terms of people dying of COVID is 2 to 3 times what we're reporting as actual COVID deaths, what are reported to us as actual COVID deaths. So that's the essence of the discussion. But you should have received a PDF of the World Health Statistics, and you should have received some links to much more detailed information on our site that will help you out there.
Jamie, you have a follow-up?
I just wanted to apologize for having missed that email. Thank you.
Okay. John Zarokostas.
Yes, good morning, Christian. I was wondering if you have now the list of the international experts that will make up the panel that already held its meetings this week. The experts were appointed last week. What is the snag why the list hasn't been sent to us as we requested?
Christian, I guess you have to unmute yourself. I see you are connected still, but we can't hear you.
Sorry, I didn't catch the question because I was not meant to be on. I was just having a chat with Fadela, who was actually online and wanted to join. So I don't know what happened. Sorry.
He would like, okay, John, you're still on.
Repeat? I'll repeat the question. Yeah. Basically, the list of the international experts that make up the panel that already held its initial meeting this week, they were appointed last week. What is the snag? Why we haven't been sent the list of who are the international experts on this list?
I believe Margaret has the answer just as much as I have, which means, as far as I know, the panel was still being formed. So only you're referring to the panel which was introduced yesterday or the day before, right? So whether the two co-chairs are announced and the rest of the panel has been formed, and when it's ready, it will be announced. There's nothing behind it apart from that. So instead of giving piece by piece, it will be announced when it's ready. But I'll refrain from giving more comments now because we have a WHO spokesperson with you at the briefing, so we're not making this a three group here. Sorry, guys.
Okay, so we have another question from Peter.
Yes, thank you. I'm glad to see there's a cast of thousands from the WHO here today. I was just wondering about the Global Health Summit in Rome. There's a lot of attention. There's some very high figures appearing at that, and we haven't had any news about today's press conference. Is there any linkage between these? Is the DG going to be speaking at that? And do you have any news about today's press conference? Thank you very much.
Yes, there will be no press conference, no COVID-19 press conference for WHO, because you're absolutely right. The DG will be speaking at the Global Health Summit. It's timed for mid to late afternoon.
Katrina?
Yeah, well, are we
Peter, sorry, go ahead.
Yeah, are we likely to get a copy of the DG's speech in a timely manner? Thank you.
That is the plan. But I cannot tell you exactly when you will get it, but we will. I think the plan is certainly to send it out to you.
Katrina.
Thank you, Alessandra. Hi, Margaret.
Hi.
Yes, my question was also related to the speech of the DG, if it could be sent out not during the night, because it would be a bit too late, but as a reasonable time. And Alessandra, may I ask you please to share the contact details of the ICRC representative, please?
Sure. I think they were in the the contact detail. You want the email? Yeah, sure. We will do it just after the briefing. Maybe if Solange listens to me, she can already do it. Thank you very much. So there are no more questions. Margaret, we put you at rest. Thank you very much. I have a few announcements still. Today, as you may know, because it's an important day, it's International Tea Day. Adriano Timossi has just sent you an invitation for a virtual celebration of this important day, which starts soon at 12:30 on the FAO webcast website. And he sent you the link for the registration to the event, which I hope you will be able to attend. Today is also World Day for Cultural Diversity, for Dialogue and Development. We sent you the Secretary General message on this important day, where he says that culture is the flower of the human being. Culture is also a powerhouse. The World Day for Cultural Diversity recognizes this great power, and so does the proclamation of 2021 as the International Year of Creative Economy for Sustainable Development. But these observances fall at a difficult time for culture. As vaccines generate hope, the world must ensure that pandemic recovery packages encompass the needs of cultural institutions, the arts, and all those who are part of the creative world. Let us all support culture and its power to advance dialogue and development for the benefit of all. And on this theme, today, the President of the General Assembly has convened a high-level event on culture and sustainable development with the theme Building Back Better towards a more resilient and impactful sector throughout COVID-19 and a decade of action. There are a number of important speakers in this high-level event, which will start at 10 a.m. New York time, and that you can follow on UN Web TV. I also wanted to tell you that the Conference on Disarmament is holding this Friday morning a public plenary meeting, the last one under the presidency of Ambassador Yuri Borisov-Sterk of Bulgaria. Cameroon will then assume the presidency of the CD until 18th of June. And for the Committee on the Rights of the Child is concluding today at 2 p.m. the review of the report of Luxembourg. And you have definitely seen for next Thursday, 30th, the special session of the Human Rights Council. And this is, Rolando, I think he's sent you an announcement yesterday afternoon. And of course, he's available for question if you need. I think I've told you everything I had in my list. If there are no more questions, and I don't see any, thank you very much for having followed us, and have a nice weekend.